Welcome to the introductory course for the NIDEK AL Scan Optical Biometer. You can follow along with these videos with the operator's manual. For more information, please visit our website at usa.nidek.com. General overview. The AL Scan Optical Biometer is a medical device that optically measures eye components such as axial length, central corneal thickness, anterior chamber depth, corneal curvature radii, corneal cylinder axis, white-to-white distance, and pupil diameter. Using optional ultrasound probe attachments, axial length and corneal thickness can also be measured using the AL scan on patients who are not able to be measured optically. The AL scan also performs calculations to assist physicians in determining the power of the intraocular lens for implantation. Chapter 2, Device Configuration. Here is a right side profile of the AL scan. The black power switch is located on the base of the device. To turn it on or off, flip the switch. It is safe to turn the machine off using this switch without any shutdown procedure. The side panel is located next to the power switch. Open it by pushing down on the tab in the lower left corner. The USB port is used for backup of the device, database, and device parameters using a flash drive. The LAN port is used to connect an external computer with a LAN connection. Depending on the configuration of your AL scan, you may have more ports available to attach the optional ultrasound probe stand with A-scan and pachymetry probe attachments. On the patient side of the device, we see the patient chin rest, forehead rest, and eye level marker, which is used as a guide for the patient's eye level during measurement. The height of the chin rest should be adjusted so that the centered level of the patient's eye roughly aligns with this marker. The chin rest is adjusted using the up-down buttons that are next to the joystick. The joystick controls the movement of the device, as well as the start button on the top to begin measurements manually. The LCD touchscreen is able to be tilted to allow for improved viewability. The locking lever is located behind the joystick. This is used to move the device if necessary. The cover open button is located above the locking lever. Pressing this opens the printer cover and allows for replacement of printer paper. Insert printing paper with some hanging out and close the cover. The underside of the device houses the power inlet for power cord connection, the optional foot switch connector, and external fixation lamp connector. Chapter 2.1, Registering IOLs. To register an IOL that is not already preloaded onto your AL scan device, press Menu in the top right corner of the patient list screen. Next, press Parameter Settings. In the top right of the screen, press the IOL button. In the bottom of the screen, press the IOL Settings button. We're now going to press the up and down arrows in the top left corner of the screen to choose a lens we wish to replace with our new IOL. To clear the current IOL data on screen, press the DEL delete icon next to the down arrow. This will clear all the data for this IOL slot. You can now enter the information of your IOL by pressing each of the blue buttons next to the desired field. You must begin with the model and manufacturer first. When complete, click the Add button at the bottom of the screen to save your work. Chapter 2.2, Customizing Default IOL Calculation Output Views. Here we can set the default display setting of the IOL power calculation screen. There are 8 available views for customization. To change the contents of the display setting, press the View Pattern button under the IOL parameter settings. First, select the desired display format to change by pressing any of the buttons for View 1 through View 8. Next, press the IOL formula button for IOL 1. The formula window appears. Select the desired IOL formula, then press the OK button. To change the IOL model for IOL 1, press the IOL name button. The IOL list appears. Select the line of the desired IOL, then press the OK button. Repeat these steps for IOL slot 2 through 4. Press the OK button from the View Pattern screen to complete your changes. Chapter 3.1 Optical Measurement Screen. From the Patient List screen, select the desired patient by tapping on their line in the database. Next, press the OPT button to access the optical measurement screen. The Mode button displays the Measurement Mode window to select the desired measurement item. Auto 2 mode captures all the possible measurement types and, if set, will remain until changed. The Auto Shot button is used to toggle the Auto Shot function. Once proper alignment is achieved, the measurement will automatically start. If any measurement is of poor quality, in yellow text, Remeasure will appear. Ensure proper alignment and press the button on the joystick. The Tracking button should display 3D to allow for X, Y, and Z plane alignment. If 2D or off is displayed, press the button until 3D is shown. Save Output IOL button is used to finalize and save the measured data being displayed. Then move to the IOL power calculation screen to calculate the IOL power. The Patient List button will return you to the Patient List screen. The Verify button is used to move the measured value confirmation screen. The OPER button displays the operator list window to select the operator. The US button, if optional ultrasound probes are attached, is used to move to the ultrasonic measurement screen. The DEL button is used to delete the measurement data being displayed. The center of the screen shows the latest data display. Once each measurement is complete, FIN appears to the right of each item. To the left and the right of the center displays the measured screen. During alignment, the center of the screen displays the anterior image of the eye. Follow indicators showing the working distance. Red arrows indicate the machine needs the operator to move in the direction of the arrows. If the lines are above the center, pull the joystick away from the patient. If they are below the center, move towards the patient. Once the indicator markers are single yellow lines, it is of optimal position and ready for capture. Chapter 3.2 Measured Results Screen. From the Patient List screen, select the desired patient to view measured data from a previous exam. Next, press the Results button in the top right corner of the screen. Here we see the exam dates with measured data from each exam. To view more detailed information, press on the desired exam measurement and then press the Detail button in the top left corner of the screen. We can now switch between the different measurements by pressing on the tab at the top of the window for each measurement type. Chapter 3.3 Toric Lens Assist Mode. An anterior segment image is overlaid with the steepest and flattest meridians to measure the angle between the meridians and markers, so as to use the value as a reference for toric IOL implantation. First, select or enter the patient information in the Patient List screen. Then, press the Toric button. Auto and 3D should be displayed below the patient information box. If not, press each button until they are displayed. Clean the forehead rest and chin rest that contact the patient. Ask the patient to remove any glasses or contact lenses and sit on a chair at the device. Have the patient place his or her chin on the chin rest as deeply as possible and his or her forehead on the forehead rest lightly. If necessary, adjust the table height and chin rest height. The chin rest adjustment is performed using the up and down buttons next to the joystick. The patient should have their eye aligned with the eye line marker on the side of the forehead rest. Using the joystick, move towards the patient's eye until the auto alignment takes control. Remove your hands from the device. Tell the patient to blink and open wide, look straight ahead at the red dot, and keep open as wide as possible until complete. Once captured, an anterior segment image will be displayed. The green line is the angle reference line which can be moved to the marker position by specifying a landmark. This creates an angle in relation to the steepest meridian. During surgery, implant the IOL so that the angle of this marker and the toric lens axis mark is the same as the angle obtained in the Toric Lens Assist Mode screen. Press Save to save the measurement. This can be saved later onto a USB device for printing from a computer. Chapter 3.4 IOL Power Calculation Screen. To display the IOL Power Calculation screen, first select the patient from the Patient List window and press the IOL button. The selected eye button indicates which eye is displayed for single eye calculation results. Pressing this button switches the display to the calculation results of the other eye. This button is disabled when View 1 through View 4 is selected. Select View button allows you to select the view of the calculated results. This can be customized in the parameter settings under Menu from the Patient List screen. Save Output button is used to save the calculation results. Patient List button returns you to the Patient List screen. Results button is used to return to the Results screen. Save Output Recalculation button is used to save the calculation results. Refractive Target field is used to input the desired postoperative refraction. Implant IMP field is used to display the Select Implant IOL window. Choosing the IOL to be implanted displays the model name, manufacturer's name, and the power of the IOL. The Measure Results is at the top of the IOL calc screen. To use values measured by other devices for calculation, pressing this field displays the Measured Values window. Press Select to change the AL and ACD measurements to ultrasound if measured with another device. The IOL Formula button displays the formula used for the IOL 1 through IOL 4 calculation. A formula can be changed by pressing this button. The Calculated Result display area displays the calculated results of the IOL power when inputting the values necessary for calculation is complete. The IOL power close to the calculation results and expected postoperative refraction when the IOL is implanted are displayed for each IOL. The expected post-op refraction closest to the desired post-op refraction is highlighted in light blue. If the IOL to be implanted is selected, the selected refraction displays in dark blue. Chapter 4 Before First Use. Place the device on a stable table. The device should be in a room with dimming lights. Move the base fully to one side and lock the main unit to the base unit with the locking lever. This allows you to lay the device down gently. At the base of the device, connect the power cord to the power inlet. Connect peripheral devices if necessary. Stand the device upright. Unlock the locking lever. Confirm the power switch is turned off and plug the power cord into a wall outlet. Turn the device on with the switch on the side. The Model I window appears. Press the Close button or X button. Register any necessary IOLs to the AL scan, found in Chapter 2.2. Attach the shading plate to the headrest. Chapter 5.1 Model I Use. The Model Eyes are used to check the calibration of the AL scan. There are two types of Model Eyes provided with the device. Use the AL model to check the AL or KM measurement. Use the ACD model to check the ACD measurement. First, pull out the two fixing pins from the chin rest. Remove the cap from the AL Model I. Place the Model I on the chin rest with its lens towards the measuring window. Then insert the fixing pins. Turn on the power switch of the device. Adjust the height of the chin rest with the chin rest up and down button until the lens of the Model I aligns with the eye level marker on the forehead rest. Press the Model I button on the window displayed at startup. Align the Model I and push towards until auto alignment takes control. Once complete, confirm the measured values are within the range indicated on the sticker. If they are not within the range indicated, please contact our technical support at 1-800-223-9044, extension 2. Remove the Model I from the chin rest and replace the cap. After the check, switch to the ACD Model I. Remove the cap from the ACD Model I. Attach it to the forehead rest. Ensure that you have the shield attached to the Model I. Press the Mode button and select the ACD button. Press OK. Once the measurement is complete, again confirm the values are within the range indicated on the sticker of the Model I. Remove the Model I from the chin rest and replace the cap to the lens. Press the back button to move to the new patient entry field. If you wish to select a previous patient, click the Close button. You're now at the patient list screen. Chapter 5.2, Creating New Patient, Selecting Existing Patient. To register a new patient from the Patient List screen, click the New button. Tap each field on the blue button to enter the patient information. Checking the Auto ID box in the Other tab in Parameter Settings automatically assigns ID numbers in numerical order. The Memo field allows you to enter comments for the patient. Make sure to select the correct conditions for the right and left eye to be measured. Press the Type button to display the eye type window. Select the condition of the right eye and left eye. Press the OK button. Once all desired patient information is entered, press the OK button. To select an existing patient, use the up and down arrows on the right side of the screen to move pages if you have a large database of patients. Press on the desired patient file. Select the function by pressing the following buttons. OPT button performs optical measurement. TOR or Toric button creates an anterior eye segment image with corneal meridians or displays the saved result of the toric lens angle measurement. IOL button calculates the power of an IOL. Results button displays the measured or calculated results. To edit patient data, select the patient to be edited. Press the Edit button. Edit the desired items. The ID cannot be changed and is grayed out. Press the OK button. Press the Yes button to overwrite the data. Chapter 5.3, Performing Optical Measurements. Create or select patient. Press the OPT button. The optical measurement screen appears. Press Mode to ensure Auto 2 is selected. Press OK. Ensure Auto and 3D are showing next to the Mode button. If not, press each button to cycle to Auto and 3D. Prepare the patient for measurement. Clean chin and forehead rests that may contact the patient. Have the patient put their chin on the chin rest as deeply as possible and their forehead lightly against the rest. Adjust the table height and chin rest height to allow for comfortable position for the patient's neck. Ensure the eye of the patient is aligned to the mark on the forehead rest. Instruct the patient to blink several times, then look straight ahead at the red dot and hold eyes wide open. Move the joystick so the patient's eye is on the screen and move towards the eye. The auto alignment will engage and take control. Continue to inform the patient to look at the red light and hold still. The measurement will begin once the alignment is correct. Repeat steps for the other eye. After complete, tell the patient to sit back and relax. Press the Verify button. Check the details of the measured result and ensure they are satisfactory. Improper data can be deleted. However, after the measured data is saved, the finalized data cannot be deleted. Press the Save Output IOL button. Chapter 5.4, Calculation of IOL Power. After you have obtained all necessary measurements successfully using the optical measurement screen, it is now possible to calculate the power of the lens for the desired target refraction outcome. It is important to verify the measured data first before calculations. Once data is gathered, press the IOL icon after selecting the patient from the patient list screen. The IOL power calculation is performed automatically. The screen will display raw data gathered at the top of the window. To enter manual data, tap the Raw Data Gathered screen. Press the Select button and choose Ultrasound and click OK. It is now possible to enter ultrasound measurements of AL and ACD measured with another device. View 1 through View 4 display both eyes on one screen, and View 5 through View 8 display one eye at a time. To change the desired target refractive outcome, press the Refractive Target field. You may set the default in the parameter settings for each physician. To choose the implant for surgery, press the implant button to select the lens. Press OK after highlighting the lens. To change the formula on the fly, press the formula under the desired IOL slot. Choose the desired formula, press OK to confirm. To change the IOL lens on the fly, press the IOL under the desired IOL slot. Choose the desired lens, press OK to confirm. To save any changes, press the Save Recalculation button. Chapter 6, IOL Constant Optimization. The IOL constants for each used IOL can be optimized with postoperative data. A minimum of 8 eyes with postoperative data are required to perform optimization. Note that for a patient to show in the optimized list, you must have selected an IOL lens power under the implant field in the IOL calculation screen and save. If you do not choose a lens power under the implant field, the patient will not be displayed. Press the menu button in the top right of the patient list screen. The menu window appears and press the Optimize button. Select the patient in the list and press the Post-Op Data button. Enter the refractive error after surgery in Postoperative Data window. All fields must be entered. If there is no cylindrical correction, enter 0. You will enter the exam date of post-measurement, surgery date of operation, and finally enter the best corrected visual acuity. If you wish to exclude data from being included in optimization, check the Invalid Data box. After 8 patients are entered, press the Optimize button. The Optimize window appears and check the calculation criteria. After setting criteria, press OK button. The IOL settings screen appears with optimized IOL constants. The optimized IOL constants are displayed in the optimized field. To change the IOL constants, press the optimized value and hit OK to accept. This will copy the value in the box to the left. Thank you for watching. For more information, please visit our website at usa.nidek.com. To contact us by phone, call 1-800-223-9044. NIDEK, the art of eye care.